It's important to know that we've been preparing for this over the last several weeks. We've had multidisciplinary meetings, both clinical and non-clinical, throughout the hospital, from our emergency preparedness teams, our EMS teams, all the way to our critical care teams, and everywhere in between. We're meeting on with our CDC colleagues, our state colleagues, and all our departmental colleagues. We've been in contact also with our community leaders to develop a comprehensive emergency preparedness programs. I would echo a lot of the comments that were here about communication. That is very important and key. We're asking patients, if they're ill, to please contact their primary care providers, not showing up at offices or in the emergency department. But it's important to know that if it is an emergency, our EMS teams are fully prepared to take precautions on that. While there have been no positive cases to date, as has been indicated, there have been patients that we've evaluated of persons of interest that we've gone through clinical criteria pretty comprehensively. I will say the communication at the emergency level compared with our teams has been superb and has gone very well. And these evaluations will continue. Their meetings are day to day, sometimes hour to hour. There's a lot of spontaneous meetings depending on the situation and how it changes. The testing right now is conducted at the state level in Rocky Hill. So if a patient comes in and meets certain clinical criteria, which we have an algorithm on, and we're changing that and reevaluating that frequently. If they meet that algorithm, there's a discussion amongst multiple practitioners. We discuss that with the Department of Health, and then there's a decision made at that level whether the patient meets criteria to test, not test, self-quarantine, or so on.
Have you had people actually come to the hospital requesting a test?
Not so much. There's been more, we've gotten calls from primary physicians asking, but it's usually there's a discussion amongst the primary physicians. And again, it's at that level, discussion with the primary care physicians or providers. And we've discussed it with the emergency room physicians of patients who may have been concerned they may have met some of that criteria. So we've had those discussions. I'm not sure if they've specifically about asking for a test, more so to be evaluated.
Has the hospital put together, anticipate the number of beds that it might require, and does it feel that it will be able to meet that requirement, assuming you've done that, you've come to such a figure?
It's a very good question. We're prepared and maximize as many resources as we can within the network. So we have special rooms that have to be set up at this point based on criteria set out by the CDC and WHO. And so we have those rooms here. We have more than some other hospitals. Some other hospitals have more than we do. But we've prepared those. We've cleared them. They need to be inspected, make sure they're working, and staff are taught. So we are prepared. We started mock drills weeks ago with this and continue to be prepared and change as the situation changes.
How are you doing in terms of other resources, respirators, masks, et cetera?
Yeah, so that's something where our supply chain, we're again constantly looking at that, all of those things that you mentioned. Patients have asked about their own masks, and I'm sure you've read or listened that we're discouraging them because it removes that supply chain from us. If patients do get sick, one of the first things that we do is put a mask on them, surgical mask on them, if they have some of these symptoms. But we're discouraging people if they're going on a city bus or something like that. If they're not showing illness, that they avoid purchasing those. As some have said, if you're sick, you should stay home and call your primary care provider. And the communication is key. You should call your primary care provider to discuss what's going on, and because some of these may not be meet some of the criteria, and maybe something else. So that's very important communication.
This is the world's third coronavirus, and since this is your specialty, I was just wondering if that, based on your own research, if you just have either a hunch or an idea in your mind of just how severe you anticipate this becoming?
I don't have a hunch, and this is not the third coronavirus. We actually have coronaviruses in our community. So it's important to note that we have panels at the hospital, respiratory panels, tests that we've had for quite some time that pick up coronaviruses. Unfortunately, it doesn't pick up this one. So we don't have local testing that picks up this specific strain. This is new because none of our immune systems have seen this. And so it becomes a problem. We don't know. A lot of the answers are, unfortunately, we're not sure. We don't know at this time. It's very much a real-time process. So we're trying to figure that out. As far as maybe the other two you're referring to, which was MERS or SARS, which were coronaviruses, they were a little bit different in the fact of some had higher mortality or death rates that we're seeing. Some were spread not as quickly or contained. So they all have, each viral epidemic has its own distinctions. And we're still continuing to try and understand that.
Just one more. We're getting into springtime, warmer weather. Is there any reason to think that that will make a difference? We talk about the flu season being
Right.
in winter. Is there any reason to think that this has a season?
Again, we're not sure, but after containment, there's a strategy called mitigation. And mitigation, one of the strategies is social distancing. So as the warmer weather gets out, people spend more time outside, and that sort of may improve things, but we're not sure. But that is sort of the possible theory behind that. But there are cases in warmer countries, at this time. But we're hopeful, but we're not sure.